Good afternoon. Thank you for joining NC Start Central as we look at our poster for the Virtual SNTI 2020. This year, we were really looking to cover a topic that spoke both to the challenges that individuals with IDD in the NC Start region face regularly, but also one that has been exacerbated by the rise of the global crisis that we are all currently experiencing. Given the COVID-19 crisis, the NC Start Central region has noted an increase in expression of suicidal ideation for the individuals served utilizing our crisis line. And interestingly, the limited amount of published literature on suicide in the IDD population does not address prevention. Rather, it focuses mostly on risk factors and best practices for screening. We noted that a lot of those best practices fit very much in line with the work that we do at START through our coaching program. Things like meeting the individuals where they are, providing visual support, adapting to the individual's level of emotional understanding, sitting in silence or allowing processing time, and providing opportunities for communication through a variety of modalities like art, movement, visuals, and writing. So on our poster, you can see how the best practices line up with the coaching objectives that we utilize for a case study. This case looked at an individual that START has served for a period of time now who has dealt with a great deal of traumatic grief, which has led to an ongoing expression of SI and continued crisis. Through coaching for her, we identified several very exciting outcomes. First, we saw a significant decrease in crisis calls following the use of our coaching program. There's only one crisis call that with a mention of SI and 3 non-crisis calls where she was simply calling to talk through and remember how to use some of the coping strategies she utilized. There's been a regular implementation of strength spotting and use of PERMA for resilience and self-esteem building amongst her team. And they have used an ongoing adapted DBT strategies that coaching helped utilize to promote reframing of both challenging situations and then recognizing this individual's ability to change her thoughts and actions. We helped work with the team in this way to reframe what they saw oftentimes as attention seeking as related to her expressions of suicidal ideation as connection seeking. As you can see from the graphs, we've seen a dramatic decrease in crisis outcomes, and this has led to a lot of considerations for the future. We really want to gather more data on START recipients who experience ongoing suicidal ideation and the use of our therapeutic supports to decrease this level of crisis. We see that our coaching program utilizes best practices in support of individuals with IDD experiencing SI, and it can be utilized as a proactive technique for suicidal ideation prevention. There is a needed increase in access to therapeutic modalities, especially in our region, but probably in general, to support individuals with IDD in the community. And we are also looking to provide outreach to systems and support around suicide risk factors such as mood disorders, abuse and family loss, isolation and loneliness, all of which are things that are very much related to the crisis that our entire world is going through. We really found the SIRS data and the outcomes from our coaching program to be quite inspiring, and we're looking forward to continuing to use these outcomes to inform our practice going forward.